Hello, welcome to the fourth med course. In this lecture, we'll be discussing acute and chronic diarrhea. So let's go. Diarrhea is alteration in normal bowel movement, which is characterized by increased frequency, volume, and consistency, that is increased water content of stool. Clinically, it can be defined as increase in stool frequency, that is passage of 3 or more liquid or semi-formed stools in 24 hours in one day. This is the epidemiology. The risk factors for having diarrhea include ingestion of unsanitary water supply, that is poor water supply, poor general environmental sanitation, poor food and personal hygiene, malnutrition, and lack of immunization. A proper way to categorize these risk factors will be the environmental factors and the host factors. As we can see, the upper three, that is the water supply, the sanitation, and food hygiene, are environmental factors. However, if a person is malnourished and if the person lacks immunization for appropriate organism like rotavirus, such a person can come down with diarrhea. In classifying diarrhea, it can be classified, and I'll give classification and definitions of those classifications as acute diarrhea. Acute diarrhea is diarrhea which lasts for 14 days or less, that is less than 2 weeks. Persistent diarrhea is diarrhea which lasts between 2 weeks and 4 weeks. So you have a diarrhea lasting for more than 14 days but less than 4 weeks. Chronic diarrhea is diarrhea which lasts for more than 4 weeks. Then dysentery is when you have blood or mucus, blood and mucus in stool. So in discussing the pathophysiology, that is how it comes about, it is important to know that acute diarrhea generally comes as a result of incomplete absorption of water from intestinal lumen, which leads to increased water content and then reduced consistency of the stool. And this is brought about by either increased osmolality of intestinal content, excessive stimulation of intestinal secretion, that is, there is excess intestinal secretion, or when there is damage of the intestinal mucosa, leading to defect in ion transport, and it leads to increased exudate of fluid. Another cause is altered intestinal motility, which leads to increased evacuation, so that the person passes stool more often than normal. So this slide shows mainly the major mechanisms that lead to diarrhea. That is either osmotic, when unabsorbed intestinal content draws water into the intestine; secretory, when the intestinal wall keeps secreting fluid abnormally; inflammatory, brought about by infections; or when there is increased motility. Having discussed the general mechanism of diarrhea, we'll focus on acute diarrhea, then later discuss chronic diarrhea. So acute diarrhea is mainly caused by infectious agents. We should recall that we say acute diarrhea is diarrhea lasting less than 2 weeks, which means that they are caused mainly by infectious agents. Among these infectious agents, we have bacteria, viruses, and fungi. Some bacteria, viruses, fungi, and parasites which cause it are listed here. So, going specific about each causative agent, important points are listed here. For E. coli, there are different types of E. coli. There's the enterotoxigenic E. coli, which causes what we call the traveler's diarrhea. The enteropathogenic rarely causes disease, and when it causes disease, it is not so severe. However, enterohemorrhagic E. coli causes a bloody severe diarrhea, and it is the one that is linked with hemolytic uremic syndrome, which is seen in 6 to 8% of this patient. Campylobacter jejunum is commoner in people that keep poultry or cattle or other animals, and it is also associated with Guillain-Barré syndrome, which is a form of polyneuritis. Shigella has a high fatality case, and so also is Vibrio cholerae. Viral agents, notable among them is the rotavirus and calicivirus. Parasitic diarrhea too is very rare and it is only discussed in travel medicine. So the clinical features of acute diarrhea include fever. As we know, they are caused by infectious agents. Then there might be blood and mucus in stool. When it is caused by invasive agents, there might be vomiting. They might also have prodromal illness, which will point to a viral agent. There might be dehydration as a result of increased loss of fluid. So in evaluating a patient with acute diarrhea, what we need to do is to take a proper history, examine the patient, and assess for dehydration. As we know, dehydration is the main cause of morbidity, complication, and mortality, such as acute kidney injury. So listed here are some of the things to check for on history, the physical examination, and how to assess dehydration. Some clues might give out the agent, such as the incubation period, and some things like if the person have traveled, then you can think of traveler's diarrhea. If the person has HIV infection, you can be thinking perhaps it's from HIV.